Our next speaker will be Sai Balasubramanian, a medical student candidate. Those of us who interview medical students or medical trainees, we always marvel that the students who are coming up behind us have better resumes than the rest of us. And Sai is an excellent example. He's an MD, JD dual candidate. Please welcome Sai.
Thank you so much, and thank you to all of you guys for giving me an opportunity to speak today. As you mentioned, I've actually finished my legal degree, and prior to that, I was in strategy consulting for a couple of years, so now coming in as a medical student with somewhat of a unique perspective. And I want to speak with you guys about something that's kind of important to me, which is a loving attitude at work and how to cultivate that in the modern healthcare landscape. And so one of the first things that people ask me, well, I guess people ask me two questions about why I do my degree. The first is, am I crazy? And the second is, what do I want to do with it? And eventually the idea is that I want to bridge the huge gap that there is between physicians and the law, and a huge gap that I feel that a lot of us feel that there is, especially in terms of advocacy. So a loving attitude at work, what is it? Well, when I was thinking about this concept, I was thinking about how a lot of healthcare leaders and people in this room, and including myself, we take active approaches to achieving a lot of things, specific skills, specific procedures. We really take active conduits to do exactly what it is, and we learn based on measurable goals, and we set up metrics for ourselves, and we achieve based on those metrics. We say, this is how I did this, I failed this test, therefore I have to go back and learn it. But when it comes to something like having a loving attitude at work, I know myself, and I'm sure a lot of you, probably take a more passive approach to this, right? We say, we wake up every day, I would like to think we all wake up every day, and go into work thinking, well, let's be good people today, let's be generous, let's have a loving attitude. But how many of us actually sit down and do metrics-driven results for something like this, right? We go to centers, we go to discourses, we get all these ideas about how we should be better people, but how many of us come back at the end of the week and think about how we should better ourselves and what kind of metrics we should be using to measure something like this? And that's when I really started thinking, what if we all started taking a more active measure in this? What if we actually treated this just like any other skill set and made it something that we work on a weekly basis, just like any other surgical technique or medical technique? And maybe we see results just like we see results in everything else. And what would those results really mean in the grand scheme of things? Because after all, it's a pretty simple concept of loving attitude at work. Be generous, be kind, be forgiving to people that you see around you in the healthcare landscape. But what if we took an active approach? And I want to talk a little bit about this in the modern healthcare landscape, because as we all know, healthcare today is very different than it ever has been, and it's constantly changing. So I want to start with the why. Why should we do this? And then maybe talk a little bit about my own ideas and what I've done to maybe start thinking about the how. So what is the modern healthcare landscape? So I sat down and I thought about what is wrong with today's healthcare system, right? So providers are overburdened, healthcare systems are overburdened, costs are up, patients are frustrated, job satisfaction is low, and overall patient satisfaction is low. And by no means am I underplaying all the great successes that our medical field has brought, but these are kind of the biggest problems that I saw. And when I listed these down, I knew the first three, there's no way that we could ever touch on an individual basis, right? The fact that everyone's overburdened, the costs are up, has simple supply-demand economics behind it, so not much we can do. But what about the fact that patients are frustrated, job satisfaction is low, and patient satisfaction is low? Maybe there's something that we can do on that side. And maybe if we start practicing a loving attitude at work on an active manner, maybe that's something that we can actually effectuate change. And maybe if all of us took that away, if all of us took away a more active life after today, then maybe we could actually move the compass needle on that end. Next slide. And the idea is that eventually we want to be able to do this. Yeah, let's try again one more time. Okay. And the idea, yeah, there we go. Thank you. And the idea is to actively cultivate that attitude to maybe transform healthcare from a commodity into a duty. And if we start seeing it as a duty, when you take this as our job, as we would any other technique that we learn at work every day, and we start making active notes, then maybe we can make a difference here. So overall, this is a pretty macro-scaled goal, right? Why would we do this? What is the carrot? Of course, if we do this overall, sure, you're going to tell me, we're going to see that less patients are frustrated, more job satisfaction. But what is the good for me, right? Why would each of us go away today and make this a personal goal for ourselves? Well, I want to introduce you guys to some of the empirical research of what we could do, or what could really happen to our practices and our lifestyles if we did this. So speaking from the legal perspective, factors that prompted families to file medical malpractice claims. 13% believe that physicians refuse to listen to them. 32% believe that physicians don't talk openly. And 48% believe that physicians were trying to mislead them. Which I think, again, is an interesting perspective when you're considering the loving attitude at work. And what is it that we cultivate with our patient-physician relationships? So these, I thought, were two very interesting studies, very incongruent with my legal training. So two different universities, academic centers, implemented an error disclosure program. And what I thought was very interesting is both of these studies realized that after they implemented formal programs where their healthcare providers disclosed their mistakes to their patients, you saw that the overall costs of liability claims and overall cost of healthcare actually went over time, which is very antithetical to what you hear in the legal field, right? I mean, in the legal field, the first thing that we learn is admission of fault is admission of guilt, right? And you train people to say, don't say sorry as soon as you make a mistake, because that can be used against you in court. Whereas here, you see the research actually showing that when there's a formalized program stating where physicians should actually admit their mistakes, patients are half as likely, if not more, to sue their physicians, which I think is very interesting. So right here, we see a huge benefit to seeing, and these studies were actually pioneered by MD-JDs at these respective universities, and I think you see a huge benefit to what the positive benefits of cultivating that relationship with your patients and with your consumers can be. And I think, again, it goes back to making an active progress, an active step in that loving attitude in the work. So what about the medical perspective? Well, time after time, it's been shown that the beneficial effects of a good patient-clinician physician on healthcare outcomes are of similar magnitude to established well medical treatments. And people empirically state that unlike any other medicine, a good patient-physician relationship is probably the best cure ever. And we hear anecdotally, a happy patient is the one that comes out better in the long run. And so maybe, again, there's something to be said empirically about what we can do with this. Doctor-patient communication. Most complaints about doctors relate to issues of communications, not of clinical competency. Patients want doctors who can skillfully diagnose and treat their sicknesses, as well as communicate with them effectively. Again, going back to this idea of the fact that patients ultimately are putting a huge premium on the relationships with their providers, and not so much the medicine itself. So moving on to the how, right? We've talked about why, and we've talked about how we can effectuate macro-scale change as well as change for each of us in our individual practices as healthcare providers. How do we do this? And these are just some ideas that I've been working on as I go through my medical training and areas of improvement that I've found that really work for me. So communication. How are we delivering the content to our patients, and are we listening to them? Yesterday we did a great mindfulness workshop about how physicians and providers and healthcare workers kind of get caught up in the efficiency metrics of having to go fast and seeing more patients, where sometimes we forget the human element of the physician-patient relationship. Empowering the consumers. I know even in legal training, we don't take a lot of time to ever explain, we just do. And so much of healthcare is about doing, not explaining. And we need to keep that in mind whenever we see our patients. Conflict management. I used to have a professor in law school who used to tell me, sometimes it's as easy as picking up the phone. If a lawyer and a lawyer could just talk to each other and cut out the actual plaintiffs of defendants, half the cases would be settled. Sometimes it's just as easy as picking up the phone and talking to someone. Empathy. One of my mentors always used to say, clients never come in on a good day. No one comes to see you as a healthcare provider or as a lawyer on their best day. Everyone is coming to you on their worst day and what they see as the biggest problem. Keeping this in mind can go a long way in developing that relationship. And finally, mentorship. As healthcare providers, we have a great opportunity to teach people underneath us, teach people around us. And I think this is the next generation of what we need to do and how to teach our fellows and our students as we move up. So if we can take these different points and make these active metrics and maybe sit down weekly and reflect, what did I do this week? How could I have done this better? Are there any places where I could have maybe not gotten as angry or impatient as I did? Maybe we'll see a change in the long scale. I want to ultimately leave with a great quote by Swami, which I think really envelopes this concept, which is, develop spiritual outlook and treat patients with love and care, and make them happy and healthy. You are under the mistaken notion that mere medicines can cure the disease. If that were the case, what happened to all those kings and rich men who had access to the best medical facilities? I think this reminds us that healthcare is not about curing the body, but it's about curing the soul. Thank you so much.